Welcome to AUA Leadership in Business, an official podcast of the American Urological Association.
Welcome to the AUA Leadership in Business podcast, where urologic professionals experience the practical application of business acumen essential for success in today's dynamic professional landscape. I am Dr. Micheal Darson, and in today's episode, we will discuss the critical role of accurate billing and coding in revenue cycle management for urology. Joining me today for this discussion is Kirsten Anderson. Kirsten has over 20 years of achievement and demonstrated success leading physician practice and healthcare organizations, including more than 15 years experience, specifically in urology medical practice and ambulatory surgery centers. Kirsten received her Bachelor of Science degree from Virginia Tech and her Master's degree in Health Administration from the Medical University of South Carolina. She is certified as a medical practice executive by the MGMA, a certified professional coder through the AAPC, and certified as an ambulatory surgery center administrator by ASCA. She currently serves on the large urology group practice board of directors as treasurer. She is the CEO of Atlantic Urology in Myrtle Beach, California. Kirsten, welcome.
Thank you.
That's quite a bit of responsibility. Can you kind of walk the listeners through what kind of practice you're currently managing?
We have 11 physicians, urologists, and 7 APPs, PAs, and nurse practitioners with 4 locations. We have a wide range of ambulatory. We have 2 ambulatory surgery centers associated with the practice. We have a robust research entity, and we are very private practice oriented with a focus on the ancillary services. So coding and billing couldn't be more important to this group.
So 2 ambulatory surgery centers. Do you guys have your own radiation center?
We don't, but that's a work in progress.
Sure. And do you guys do your own path?
We do. We do our own path. We have PSMA PET. We have our own pharmacy. So we have imaging as well, CT, X-ray.
So yeah, some definitely advanced services. Sounds like a really well-run practice. Well, let's get to some of the topics here. So challenges in billing and coding in current urology landscape. What are some of the top challenges in billing and coding in urology in 2025?
I think one of the biggest challenges is the increasing administrative burden, prior auth on the revenue cycle team. 20 years ago, it was very rare when you had to do a prior auth. Now it's very rare if you don't have to do a prior auth for a drug or a procedure. So I think that's been a big change. I think along with that, prior auth is never a guarantee of payment, so careful review of each payer's policy is very key in today's environment. I think another challenge is increasing denials and rejections and underpayments more than ever. Exciting time. I think there's a lot of new technologies emerging and new drugs, but it can be very challenging for the coding and billing teams with all the new changes and new challenges around new CPT codes, new J codes, or dare I say unlisted codes sometimes. So I think it's very interesting, it's very exciting, but very challenging as well. So
Right. Let me ask you a couple of questions about prior authorization. Have you seen an improvement in the last couple of years, or a continue, I guess I would say, increasing challenge of prior auths?
I think it's become more increasingly more challenging. A lot of payers have rules and around their timing on prior auth. They have instituted AI on their side for prior auth in a lot of, so whereas before, a long time ago, it used to be you could call and get a prior auth, you could talk to somebody. That's no longer the case. So it's become more and more challenging. And we are in the early stages of automating a lot of that ourselves to be able to keep up with the increased volume as well.
How do you guys, as a practice, divide up the prior auth work hours?
So we don't outsource our billing, and our prior auth is handled in-house, which it's a choice for each practice. I think it's just we feel no one knows that better than our own people, and the majority of our staff, if they're not on site for prior auth, they're remote but local, so they have a direct line to the physicians and providers and staff to understand the issues and know what the schedule looks like, what's their priority. So I think that's key in managing the prior auth process, is having a team approach and being able to manage that, and making sure nothing falls through the cracks. I mean, that's huge.
So what if you have one physician that's practicing in an area where there's a new technology or new drug that is prior auth heavy? How do you divide that up?
So I will say the first step with a new technology or new drug is we have a team. We like to review all new procedures, new services, to make sure we don't miss anything. So billing, coding, clinical staff, operations staff, front office, prior auth, all those people working together to make sure we've considered everything that goes in to whatever it is, that we miss nothing. So I think that's been a big key, because we get asked a lot about, we have this exciting new drug, it was in research previously and now it's coming to market. There's no J code, but unlisted code, but how do we make this happen? And so it's challenging, but it's also very exciting to be that innovative practice that's providing that to the patients.
Well, it sounds like the revenue cycle folks, personnel are pretty heavily involved in that whole situation, which makes a lot of sense.
Yeah, they are. And we meet regularly to review any, to where we are with new technologies or new procedures, new drugs, both from a prior auth perspective, coding perspective, documentation, and payment policy, and what we're seeing in denials or underpayments. So I think that's very key as well, to make sure that what you put in practice is actually happening the whole way through the revenue cycle.
Talk about some of the restraints and top challenges here for this.
I think it's complex. Urology procedures can be complex to code. I think, just from a billing perspective and just keeping up with that. I think one of the challenges too is, urology, whilst I think it's a very interesting specialty, maybe I'm a little jaded, I've been in it a long time, but I think there's increasing administrative burden and the challenge of training staff to keep up with all the administrative issues. So, as we know, staffing has been challenging, and so a lot of times you have to grow your own coders, billers, and teach them what they need to know about urology coding and billing to be successful. I will say one of the other challenges we've had. Sorry. Go ahead.
No, go ahead.
I was going to say one of the other challenges we've had, especially in 2025, is the Medicare fee schedule cuts, and so we're more focused than ever on making sure we get every dime dollar that we're due from all the payers. So I think that's become more important to the practices than ever. It's always been important, but because your margins can be very, very small sometimes.
Yeah, I mean there are lots of challenges for sure. It sounds like you guys have done a lot of forethought and thinking on how to mitigate some of the risks. So that's pretty awesome. What are some of the, let's talk about keys of the RCM cycle in urology. What is being done to manage some of the challenges identified above or that we've talked about in the RCM and coding cycle?
One of the things I see more and more of to be able to address the staffing, the knowledge, the increased administrative burden is AI, artificial intelligence, and more automation on the practice side. So I think it's an exciting time, but there's emerging technologies. A lot of it's available with existing PM and electronic health record systems or add-ons on programs to be able from like tools for around appointment schedules and reminders, patient intake and registration, automating insurance verification, the billing and coding automation, looking at, claims before they're submitted to reduce claim errors and catch potential coding mistakes before they happen. I think we'll see more changes ahead with automation and AI on the physician side with prior auth. And I will say, I think we're going to see more AI coding involved with provider documentation. So it's not perfected yet, but it's improving every day. I know a lot of the vendors are working on solutions to help with that. And I know one of the hot topics is, of course, AI scribes and helping our providers with, scribe and documentation. But with that, there's challenges as well, making sure the documentation meets the requirements. So that will be very interesting to see how that's managed. There's just so many things out there. Payment processing using portals and automation with less staff intervention. There's automation around dial management. There's analytic tools for looking at undercoding as well as overcoding through regular coding audits, and like regular, tools to look at like payment policies and contracted rates and allowables and really having a eagle eye view on all that. So there's a lot of analytic and AI tools out there. It's just how do you put them in place to make your practice successful, because it's a lot at one time, and what works best and what's going to help your practice achieve their goals on revenue cycle management and achieving the collection percentages and everything else, days in AR and all those important KPIs.
So you mentioned, and I'm assuming on the insurance, big insurance side, they've already are utilizing all these tools. So probably it's accurate to say that physician practices are just catching up to these emerging technologies.
Yes, I would say automation has become big on the payer side. I know several of the large payers, you used to have a provider rep, and now they've been replaced by chat or an automated answer. So I think we have to find ways to automate to be able to support our practices and put the people to work in our practices doing the things that AI and automation can't do, because staffing has been a challenge as well.
So can you give an example or two of some of the advanced technologies that have already impacted your practice?
So one of the things we're excited about is, AI and AI Scribe. We don't have it in place yet. We're anticipating Q3, but I know there was some challenges around the AI Scribe. It's not perfect, but it's definitely getting there. We use patient payment portals, and we have seen our collection rates improve, and without much touch out to patients. Gone are the days of mailing them their bills. They pay online and pretty quickly. So those are several of the things we've done more around. The patient portal is very key, but also being able to talk to the patient using those portal methods around their bill, answer billing questions, be able to query around documentation. I think those are some key areas, but there's so much more, and we're just, really trying to dive under the surface on those. So skimming the surface on all those tools that are out there, but definitely more to come on that.
Does a lot of that research fall on you, or do you have a team that's kind of combined with the clinical side and the revenue cycle management side?
Yes, we have a revenue cycle team and they're fantastic. But I will say I get very involved in that because you want to make sure you're using the right tools with the right people at the right time. So definitely part of that process, just similar to how we look at new procedures, drugs, services, we look at new products together too, to see what's going to work best for our organization and make sure we've considered everything. Again, with our with our vendors as well, like our PM, our electronic medical record, our clearinghouse. So there's a lot to consider when evaluating tools.
Well, it seems like there's a lot out there. It's exciting to think about for sure. Let's talk about like what do best practices look like for your billing and coding team?
So, the revenue cycle management, the cycle itself hasn't really changed, but how it's achieved has. I think in a perfect world, the patient pre-registers online prior to the visit, filling out their registration, uploading their driver's license, all their insurance cards, their medical information, which is populated to the electronic medical record. There's real-time and automated eligibility checks, so that's checked automatically, and verifying the insurance coverage with benefits, knowing the patient's copays, when prior auth is needed, and not having to manually check those. When they see the provider, the documentation is timely and it's accurate, and with specific ICD coding, I think the provider places electronic orders for future services that are electronically transmitted to where they need to go, and there's a closing loop process to make sure things are scheduled and coordinated appropriately. Patients are using electronic messaging and portal to communicate with the provider team and coordinate future testing and procedures. The billing team is able to quickly verify with payers for payment policy prior auth, and it's completed online through automation. There's clear communication with the patient with financial expectations. They receive something well in advance of any upcoming procedure about their obligations, amounts due. They see all that real time as well. Op notes, procedure notes, visit documentation is completed timely with ICD and CPT verification. There's AI coding verification. The provider query is done on the coding. Claims filed with little or no charge lag. Wouldn't we all love that? If there is a denial or potential denial, is tracked in real time and addressed immediately. You don't have to wait on the payer. Payment is received timely. It automatically posted to the system and verified against the contract allowables. And electronic billing is sent out immediately to the patient. I think it's important to say all this would lead to having clear, consistent, patient-centered billing and coding practices. With all that, it's a clear message to the patient about what was done, the documentation, and the payment, and everything just would flow so nicely. So that's what it would look like in a perfect.
So a lot to talk about there. Tell us about the kind of the reception that the pre-registration online prior to the visit has gone over with the patients.
You get a lot of resistance in this area at first, but then you realize that patients in this day and age, I always say grandma has an iPad because that's how she's communicating with her grandkids, and nobody likes filling out paperwork in a crowded waiting room. So I think it's a learning curve for both staff and patients, but they really can complete everything accurately and in their own home or in their own environment on their own pace. So I think if done right, everybody prefers it to be done online and in the comfort of their own home.
Yeah, it's interesting because you get some really granular complaints about it. Like, it can be a little clunky at times, even for people that are computer savvy. And then, some of the other like more specific complaints are like, you're doing something, you get distracted and you go back and it's already timed out. And then you got to go back and do the whole thing over again. It's just, there's a lot of improvement. I think ultimately.
I'm guilty of that too. I'm probably guilty.
Yeah.
And I would say
it's ultimately definitely the right idea. It's just there.
I
think tweaks would be good.
Yeah, I think tweaks are helpful. Having your staff go through as you're implementing the online registration and with it, as a test patient, see how it really works as a patient is helpful. I think another thing is having front office staff that can help patients that are struggling with it. I think is always important because you are going to have those that just can't do it, and that's okay. So you've always got to have a workaround for those that can't complete it.
Right. Okay, you talked about clear, consistent, patient-centered billing practices, making billing clear. Can you talk more about that? Because, we all know that, EOBs are not the easiest thing to read, and, how that making it clear can impact the number of calls that you're getting back to your work staff.
I think we all forget, being in the healthcare industry, that EOBs, most people don't even know what they are until they get a bunch of them. So whether it's my family or neighbors or patients, they're always going to have questions. So I think being able to provide them clear statements, the EOBs match their billing statements, and having the ability to query either online or phone calls to our billing staff to be able to answer their questions, because we know they're going to have them. And I want to be able to provide good, consistent information to them that they can trust, with billing staff that is able to answer their questions in a timely manner. So I think that's very key, is that communication back and forth. So they have confidence in us and we have confidence in them, and we get paid. And we get the services that they need.
Okay, got it. Let's talk about coding and billing with emerging technologies in urology. What are some of the key considerations and tips and tricks before introducing a new service or procedure for your RCM team?
Yeah, and we talked about that we review all new drugs, new procedures, but that wasn't always the case. And then sometimes you find out after the fact, and that's not. So we've really moved to that proactive, looking at things ahead of time, so we can have our coding and billing team research the coding and billing guidelines, and look at payer policies, and look at NCCN guidelines, or whatever it is around new services and new procedures. And then giving the coding and billing staff the ability to query our providers. I think that's key, because we're not clinical. They know what's going on, and then they can explain it, and we go, oh, that's what you're doing and why. And we love hearing the why of what they're doing, so we can understand it and help their patients. So I think that regular feedback is key. And then the coders will query the providers and say, now I understand what you did, but I need you to say this in the documentation, because this is what the payers or the guidelines or whatever it is require. So I think that's good all the way around, to stay up and to provide that timely feedback to the providers, to the physicians on their documentation. I think it's also very important for us all to stay up to date with coding changes and updates, healthcare regulations, and government policies. Some of them, any government policy changes can happen at any time, but a lot of coding updates are happening quarterly. So it's a lot to keep up with, but it's important to keep up with because it's constantly changing.
What tips and tricks? You mentioned tracking denials in real time. Can you kind of drill down on that and tell us exactly what that entails and how it's done?
So one denial can throw a practice into a huge negative on these expensive drugs or emerging technologies. So we really like to know as close to time of service if we're going to have a denial, or because that provides us with feedback to know what to do the next time. Because a lot of these patients might have ongoing treatment, so there is going to be a next time. They've got 6 treatments coming up. So I think it's really important to get it right the first time, and if you don't get it right, get that feedback on that denial so we can figure out for the next time or the next patient. So because if you're waiting 2 and 3 months down the road, you're already in trouble because you've got other patients, other treatments, and then it's a snowball effect.
Right. What so say you have a denial, just kind of walk us through how does that work? You get a denial, then you have X amount of days to respond, and then you send it back, and then they have X amount of days. Is that how it works?
Yeah, and it can vary by payer. We have some payers, we have denials and you can do everything right and still have a denial. And, some payers per policy, we have 60 business days or whatever it is. And so, but you've got to regularly follow up on those denials too. Don't forget about them. And, that's why we meet regularly to go through our problem areas and, where we're having issues with. We look by payer, by service, by procedure. We look at it different ways so we can make sure we're tracking all those to make sure we don't lose sight of what happened and why, and be able to provide feedback to fix it.
Yeah.
And I think a lot of times that's educating the provider reps or the payers as well, because it's new to them too, and we forget that sometimes.
Well, you hope that all this technology is working on both sides to better the experience for everybody.
Right.
Any other tips and tricks you want to mention?
So I think when we're providing a new procedure, place of service, ASC, hospital, office is important, and it's key when reviewing new procedures. We always say start slowly and conservatively if you have a new procedure. Query with Medicare Part B first and move on to commercial payers. We try to look at things like, we have an unlisted J code or miscellaneous procedure. I think it's reaching out to the payers as well and saying, how do we, what do we need to do to go forward with the service? So I think all those things are very important. I think data analytics is key. So like we said, tracking denials, speeding up resubmission and increasing revenue, that's always important.
So a question that just kind of popped into my head as we're talking about all this, and especially how it affects revenue cycle management. How has your practice adapted to telehealth when we needed to do it? And then how much of your practice is telehealth now? And how are you going to change as those changes come into effect?
Yeah, we just, at the end of last year, we thought we were going to have big changes to telehealth, and we got ready for that. And then it passed to the end of March, and now it's passed again. So we have varying degrees of use of telehealth by providers. Some providers and patients love it. Some don't use it at all, and that's all okay. But we really had to keep up with being able to manage all the requirements for telehealth. And so I think we've done a pretty good job with that, but it's been a little challenging with all the potential changes for telehealth. So yeah, just keeping up. It's just like anything else. You got to keep up with the changes or potential changes and be ready. So I say prepare for the worst, hope for the best. That way you're never disappointed. You're never disappointed or unprepared. So.
Right. Yeah, it just dawned on me how much of a ebb and flow there is to the whole telehealth thing, and pending changes and all that kind of stuff. So definitely good for where do you guys where do you get your information to stay up to date with that?
So I'm on the local board, and they do a great job with the updates as it relates to urology practices for what's going on, in Congress, or, just with CMS or changes. The more sources, the better. I use AAPC, I use MGMA, I use AUA. So use it all. I think it's knowledge is important in having it. So signing up for all the e-serves, it's great because it comes in my inbox before I've even thought about it, like just passed or this is happening at the end of this month. So I think, and I pass it on to my staff as well. So I think knowledge and communication is always important.
So let's give our listeners the takeaway from today's discussion.
Well, one thing I didn't mention was payer contracts. So I will say, as we're talking about billing and coding new technologies, new procedures, new drugs, evaluating payer contracts on a regular basis is very important with all the new codes, ensuring proper coding and documentation, performing regular audits. I think it's very important to keep up and make sure your documentation meets the requirements for our changing world of urology. Denials, I think, performing root cause analysis with any denials, looking for trends, issues with coding, eligibility as a prior auth to help your denials in the future. And one of the big challenges is for any urology practice is hiring qualified staff, but outsourcing components of revenue cycle when you don't have that talent, and being able to use the emerging technology, but with caution and with a lot of thought around how you're going to use that best in your practice. So I think all those things are just very key in making sure the whole revenue cycle process is managed effectively for each practice.
Well, thank you so much for all of your expertise. This was really interesting, and congratulations on running what sounds like a really well-run practice.
Thank you. It's never boring, that's for sure. It's always changing, and that's a good place to be.
Sure. And thank you to our audience for joining us on the AUA Leadership and Business Podcast. Until the next time, continue to learn, lead, and excel.
Thank you for tuning in to the Leadership and Business Podcast. If today's conversation sparked your interest in learning more about the importance of accurate coding, billing, and reimbursement in revenue cycle management, join us for the AUA Coding Seminar. For additional information or to register, go to AUA University at auau.auanet.org. We hope you can join us for this one-day virtual seminar that's perfect for coders, practice managers, and providers.